I'm Shane Phillips, the CEO of the Phillips Group, and we're here at the HR Summit and Expo, the largest HR event in the Middle East. I'm here with Dr. Pam Jackson, former congressional advisor and one of the leading trainers and coaches here in the Middle East. Welcome, Dr. Pam.
Thanks, Shane. Glad to be here.
Great to have you. So you specialize in training within the medical profession.
I have been training and leading and coaching programs here in Dubai for the last 2 years. I've been in the healthcare sector, a lot of clinics, mostly training and educating on leadership skills and development and how managers can be highly effective. And the clinic setting, you have a lot of practitioners, doctors who became managers, and management isn't their strength. Separately though, management and leadership are distinct, and a lot of people don't really focus on what that means and the difference that is. So I add a lot of value by helping develop and strengthen leadership skills for executives and managers in the healthcare setting and also outside the healthcare setting.
So what are some of the axioms or tenets that you look at focusing on within that leadership framework that you think is really critical for leaders within those segments to pick up, or where you feel the skill gaps are that you want to close?
Great question. So I think for starters, there's usually too little communication, and there are a lot of people who think they already communicate a lot and they rarely do, or they don't communicate well about the things that matter. So inside leadership training and development, usually it's about communicate. What are you communicating, and are you communicating from a context of here's mission, here's vision, here's values, and here's how you do your work inside of that. So one key thing is communicating from mission and providing context for people who are your subordinates or even your peers. I think the second big thing is being, I would say being a manager means that you're actually organized and focused, and a lot of people in the healthcare setting are organized and focused as the practitioner, as the nurse, as the doctor. I know exactly what to do. But as a manager, I don't. And I don't care. And it's not important. And they'll just figure it out. And that kind of style usually it works well for people because in the healthcare setting, the roles are pretty clear. But in the background, you actually usually have institutional and organizational problems. People not being effective at their jobs as collaborators. I, on my own as a nurse, do quite well, but when I'm on the nursing team and need to be team building, I don't do as well. And you usually have leaders in the clinic setting who don't manage that kind of conversation well. So I coach and train around team building, communication, and actual leadership skills. Some of the leadership skills that I talk about most are people being outspoken. And in this climate here, people kind of hear outspoken, I'm American, right? It means loud spoken. And that's not what I mean. Outspoken says I'm actually in communication, speaking up about the things that matter, even if I'm afraid of a response. And in the healthcare setting, we have a lot of cultural challenge that people tend to be silent and deferential. And in being silent, they're not speaking up about the things that matter most. They're waiting to be asked about it, or they're waiting to have it be discovered there's a problem. And that's a kind of leadership training skill that I actually do for all levels of staff in the workplace setting to actually encourage and help organizational strength.
It's a very complex issue, especially in healthcare, because I saw one case where someone had given the wrong medication. Now, that person spoke up, and there was a fatality involved in it, and the board and everything, they wanted to terminate. And the CEO in that case said, you can't terminate this person, because if you do that, no one else will ever speak up about giving a wrong dose. So how do you respond? What's the appropriate response in this environment? And it's a real mind pretzel on how you approach these.
It can be. It doesn't have to be. It can be. And one of the things that stands out is there are actually regulatory guidelines for that kind of incident. But for the most part, it's actually creating the culture of communication in advance. It says, one, it is important that you speak up. If you make a mistake, we must know about it to actually take care of people. And two, depending on what it is, we'll training and development to respond to it to actually help you grow versus punishment, penalty, get fired, get gone. So that's one of the things we do face a lot of. We also encourage in our leadership training courses that people actually have to be proactive and say, I spoke up about this to my superior, they didn't do anything, I'm going to speak up again. And usually we don't have that. People like, I said it, I'm done. If there's a problem, it's not my fault, I'm not to blame. And we actually work on breaking that kind of culture. If you have to speak up 4 times in one day to 4 different people to say you had a concern, do that, because you can actually prevent these kinds of mistakes. There are guidelines in healthcare quality management. Did you speak up once or twice or 4 times, and to whom and when and how soon and how fast? And we train people, you have to come outside your cultural background and take on the culture of the healthcare environment and the mission of the clinic or hospital, and set aside any concerns about, oh, I'm not supposed to be this way, or I've never been this way, or it's not good for me to be this way. It's like, you're in a healthcare setting. Be this way. It works.
Well, great, Dr. Pam. We could go for hours with you. It's been such a pleasure having you on with us, and thank you for sharing your insights.
Thanks, Jane. Thanks for having me.
That's Dr. Pam Jackson, former congressional advisor and one of the leading mentors and coaches here in the region. I'm your host, Shane Phillips, CEO of the Phillips Group, and we are at the HR Summit and Expo, the #1 HR event in the Middle East.